It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. So sit back, relax, and let me show you how to indulge yourself Boca style. Hi there, Becky and Boca here. I am outside of Vein 911, Dr. Christopher Pittman in Tampa, Florida. I came to visit him again because he did my hand veins 3 years ago. He's one of the few doctors in the country that does this procedure. It's fabulous. The veins never came back. He also does leg veins, and he did mine. So we're going to go inside and pay him a visit. Okay, I am back here with Dr. Christopher Pittman, and I'm so excited to be interviewing him again because he is the premier vein doctor in the state of Florida, maybe the country, possibly the world. Is that right, Dr. Pittman?
That's some people's opinion. A lot of our patients here, I think, would feel that way.
And I'll tell you why. He did my hand veins 3 years ago, I think it was. I only needed one treatment. I know some people need a little bit more.
Yes.
But I had those big, you remember the big purple black veins in my hands, and now I have none.
The sclerotherapy vein.
Here is a picture of my veiny hands before you treated them. Look at all those veins. And here are my hands after you treated them. And here is a side-by-side, before on the left and after on the right.
Hand veins are kind of the last frontier for aesthetic medicine.
Okay, we are here with a patient that drives from Miami, makes the drive up to Tampa because she comes here to see Dr. Chris Pittman for the hand vein treatment that is so unique to this practice. This is the patient's hands before the procedure. So, Dr. Pittman, you want to explain what you did to her?
Yes. So we did the same thing to her that we did to Becky.
Yes, the best thing I ever did.
And we put in these tiny needles the size of a hair shaft into some of her veins. I believe we treated her twice.
Yes, twice.
Yes. And so in cosmetic medicine, you want to do just enough and not too much. She's got a few little extra ones that frankly are bothering me, okay? And even the folks that, so again, this is our canvas, right? And so we're going to not let her go out there looking bad. Just like we don't need superficial veins in the legs, they're all expendable and they can all go away. It's the same thing in the hands and the arms. So the important veins in the arms are in the muscle. So there's no danger in getting rid of any of these. If ladies don't like them, let's make them happy. It's no big deal. We kind of glossed over last time the filler issue. So fillers aren't going to make prominent veins.
You're talking about a lot of cosmetic doctors will inject fillers around the veins to kind of plump up the hands so that you don't see them.
Correct.
But what you're doing is eliminating the veins altogether.
Get rid of the veins. So there are practitioners, some of them very talented and smart, that try to tell people that, oh, I wouldn't get rid of those veins. They're important, and oh my God. And,
I have heard that argument.
And it's complete BS. Okay. So
good to know.
I could get into why, or you can go to our website, to our hand page, and I outline all the reasons why it's just not true and false. I'm an interventional radiologist, and when there's a vein access issue in a hospital, they call us. They don't call any of those other people. And the last place I'm going to put an emergency IV is in the back of a hand. I've never done it. With that ultrasound machine, we can get in any vein, anywhere, anytime, and that's not where we're going to go.
So people don't have to worry that if you take away their hand veins, they're not going to be able to get an IV.
They don't have to worry. In the hospitals these days, generally we're using ultrasound anyway to get access, especially, even nurses are using it these days. And then on the emergency side, if you're in a car wreck or whatever, you don't need them either. I'm not going to get into details of why. It's at the website. But you don't need them.
So you don't need these veins.
In the hands, we start with the bigger veins first, and then we wait a little while, and then we kind of negotiate with the patient because we're not going to let anybody go out there and look bad or, asymmetrical, because we want everybody to be a walking advertisement, right? So we do have to wait a period of time between the treatments because the moment we inject the foam, those veins die. They die on contact, and the medication's gone in about 8 seconds. So then we let a passage of time go. These are polarized glasses. They're patented technology, and the reason I think they're worth talking about is it doesn't matter how good your eyes are. If you don't use this for spider veins or facial veins or things, you're just not going to get the kind of results you can get with them. If your practitioner, I don't care how good their eyes are, aren't using polarization, you'll never get the same results. So yeah, we're just going to do, I think, a little tune up here.
So you're creating the foam now.
We're creating the foam. Boil, oil.
So this is the same sclerosant that you would use in legs, that a lot of people use in legs, but you foam it.
Correct. Well, yeah. Liquid sclerotherapy, or the liquid, is FDA approved for spider vein or small vein treatment. It will not work in larger veins because it is absorbed by your blood so quickly. So somebody smart several decades ago figured out if you make a foam out of it, it pushes the blood out of the way, and it acts undiluted on the vein wall. So we can get rid of any size vein anywhere, anytime with foam, but it's also good for small veins. And so we use foam essentially exclusively in this practice. So that's what we do. Frankly, it's safer. I mean, I can't even use liquid anymore. Inevitably, some of this medication will, get outside the vein sometimes, and it can be toxic to the skin. But foam, there's less liquid in there. There's less agent, so it's more powerful. Yet, if it gets outside the vein, it won't cause as many problems. So there's just a lot of benefits to foam and very little downside.
And there aren't too many doctors in the country that do your procedure with foam, right? You
No.
do foam sclerotherapy in the hands. Okay.
No, not many people do it, but what's probably more important is not many people who know what they're doing do it. There's some folks who are dabbling in it, which I don't recommend. You go to anybody who's dabbling in anything, so you want to go to someone who's doing vein care all day, every day, who's done a number of these hand vein procedures, because I've done a lot of redos or people who are unhappy. So there's no substitute for experience in vein care or anything else in medicine. Mm-hmm. So anyway.
Well, I know the thing about hand veins is a lot of cosmetic doctors treat hand veins with fillers,
Yes.
which they're just plumping up the area around the veins, kind of trying to disguise them. But what you do is you get rid of the veins. You're not pulling them out or anything like that. You just inject them with a sclerosant, and it's a foam.
Yes.
And over a period of weeks, they just dissolve and disappear. And I am a testimonial to that.
Yes.
You did it on me, and it was amazing.
And we did it live in a furniture place down in Boca.
Yes, we did it on a friend of mine in Boca Raton.
So, yeah, the needle's the size of a hair shaft.
I got to explain the furniture store thing. I did an event in a furniture store in Boca Raton, and I was featuring cosmetic doctors, and Dr. Pittman came down there and actually did the procedure on a woman in one of the furniture store, a very nice furniture store. Clive Daniel, yes, Clive Daniel. Yeah. And did the procedure in a chair during the cocktail party in front of everyone. That's how simple the procedure is. It's really nothing at all.
In the right hands, that's how simple it is. But, if you go back about 3 years in our Facebook posts, you'll see that. I think we posted that live. Mm-hmm. Anyway, it doesn't hurt. So those folks who think this has to be painful. It's
no pain at all. None.
It's a needle the size of a hair shaft. Most doctors have not seen a needle this small. It's a 32 gauge needle. And we use foam. It's not foam insulation. It's like cappuccino cream or shaving cream. It goes in, it destroys the lining of the vein on contact, and it's gone in about 8 seconds. So
are you watching it to see how far up the vein it goes?
I'm watching it mostly to make sure it stays in the vein. If this hurts, let me know. So the procedure works 100% of the time. There's no question of whether it's going to work for this young lady, Becky, or anybody else. So what we try to manage also is trying to get people to look as good as they can, as quick as they can. The people who drive the furthest to see us,
That's what I did.
and this young lady, generally look better quicker because their hands are on that steering wheel.
10 and 2.
And you know, when you do this, the veins decompress. We have treated as high as the elbows. There are some ladies who are in amazing shape with very little body fat, and they have a lot of veins that are cosmetically disturbing. Gosh, these have been bothering me for years, and I didn't know I could get rid of them, so they didn't realize they could.
Well, there aren't too many doctors that do this particular procedure, so they have to find you first.
Yeah, the point is I'm a radiologist too, so I've imaged veins my whole career for 30-some years, and you know, knowing that anatomy and so on is very helpful to this whole process. The background that we have is, of course, very helpful with making sure this is effective and well, more importantly, safe.
I'm here with Lindy. She is a patient at Vein 911, one of their happy customers. So you want to tell us what you like about the vein care here?
Absolutely. I was having a lot of pain in the back of my left leg from my glute down my calf.
Oh, wow.
And I have a housekeeping company, and I'm still working that company also. So I noticed I could, an hour into my day, I was already fatigued. My leg felt heavy. I had heat and pain. And I was getting to the point where I didn't really know what to do. I Googled vein disease, and it came up Vein 911. And I was like, Vein 911? Heck yeah, this is an emergency. So let me call them and see what's going on. Okay. And it said free consult. So I came in. They got me in immediately. One of the things I like is when you call, you actually speak with someone at the front desk.
Oh, it's a great staff here.
I mean, you put on hold, you get taken care of. So I came in and met with Dr. Pittman, and he took one look at my leg and said that there's definitely a problem and they could help me. Mm-hmm. So not only did he get me fit for the compression sleeve, which provided instant result.
We were just talking about that.
Gosh, it was so amazing. I was like, oh, support, relief.
Pull the veins in, tighten everything up.
Yes, so that gave me comfort. And just from the moment I met Dr. Pittman, has a great sense of humor. He's super cool. He explains things in layman's terms, so you actually understand what is
Gives a lot of analogies, which are very helpful.
Yes. Yeah. And funny. Right. So the music is awesome in here. It's 70s and 80s. So when you're in here, you're like singing. The staff is very personable. And I feel like these are my girls in here. You know, Matt's super cool. And they know me by name. I don't feel like I'm just like a chart that needs to be taken care of and sent out, you know. Mm-hmm. So I like the personal connection that I have here. And the foam injections that
He did foam sclerotherapy on you?
Yes.
Okay.
So I had thermal ablations on both thighs, and I had foam on the left side. I'm getting foam today on the right. Mm-hmm. First injection, all it felt was like a few bee stings. And then that foam, once it gets in there, that pain that I had for so long subsided.
That's the amazing part. I think people don't really understand that vein care can improve the way you feel. It's not just it wasn't a cosmetic thing in your case, but you felt better right away after the treatment.
Immediately. And as I stated, it felt like a few bee stings, but I just put my leg up. I did my half-an-hour walk, put my leg up, put the ice on it, took the ibuprofen. I wasn't sure what to expect. I had a little bit of pain in one area. They got me in that day. They scheduled me an appointment. Dr. Scholl saw me. He's awesome too. And they gave me my treatment plan and moving forward. So now I'm on my, I think, third foam treatment, and my thermal ablations are done, and I feel great. I'm back to work. I'm back riding my bike. I have my life back. I had to stop walking my dogs in the morning because I couldn't do all of that activity if I wanted to work my job. So I feel very blessed that Google gave me this search result because this is a great fit. It's a family.
Yeah.
And I feel-
And you got results. That's the most important thing.
Yeah, I got my life back. I'm not like hobbling around like, oh my leg, oh my leg, oh my leg. Now I'm like, I can dance. You
Do you
know?
think a lot of people just accept it? Maybe, we're getting older. This is what happens. There's nothing I can do.
Absolutely. I didn't even know it was vein disease. I mean, I Googled vein and it popped up disease and then it showed like the varicose vein. So I was like, all right, let's go with that. And
Right. So a lot of people would not assume that a varicose vein could cause those kind of health issues.
I don't think so.
That's what we have to educate people on.
Yeah, so the ugly blue vein that was running down my leg, I mean,
You weren't even worried about the way it looked. You were worried about the pain.
right. So now my leg looks gorgeous. I mean, it looks years younger, and I'm only in my 40s. So I am so excited because I feel energized, I feel confident, and I know that as soon as I get the rest of this taken care of come September, I'm back on track.
Right.
So
Right.
I
You
got my leg
start over. Right. I know. He did my leg veins a few years ago. And it's funny. You just get used to living with the pain and discomfort. Then once you have them done, you realize, oh, yeah, I don't have that anymore. It's, I'm back to normal. You don't even think about it.
Isn't it so free?
Yeah. And you wouldn't think, at least I didn't think that vein treatment could do that.
Right. And it's not just about the treatment. For me, it's about who is giving me that care and what kind of experience am I having. I like relationships.
Right.
So for me to call and know them by name or they know who I am, that's important to me because who knows down the line if I need their services and other people I may know. So I'm all prepared to make a huge Facebook Vein 911 is the bomb post.
That's fabulous. I think Dr. Pittman would really like that. Okay.
Especially with his personality.
Okay, well, thank you for talking to me, and I'm glad you're feeling better.
Yes.
Okay.
Have a great day.
You too. I had some pretty serious varicose veins in my legs when I came to you 3 years ago. Some bulging, dark veins, unsightly. You got rid of all of them, and they have not come back.
Schoolgirl legs for everybody, right?
It's amazing. It really is amazing, and I don't think people realize that that you can get rid of them.
Yeah.
And I noticed another thing. I was kind of skeptical when you said that my legs will feel better.
Oh, yeah.
Before I had my leg veins done, my legs were always aching. Sometimes they felt heavy. I just attributed it to exercise. I'm always in the gym. I'm always running. But after the treatment, that hasn't happened since.
Yeah.
It's really, really true.
It's crazy and humbling how much just silly old vein problems can cause constitutional or whole body symptoms. Today we use foam for hand veins, leg veins. Frankly, if you don't get foam treatment as part of your leg treatments, you are not going to be fully treated medically, and it is going to be extremely difficult to get a good cosmetic outcome. Because what you see on the skin is just the tip of the iceberg.
Exactly.
And there's still a lot of vein docs out there that do surgery on folks, but friends don't let friends get vein surgery.
No, we were talking about that earlier. You say people are still doing it surgically? They're pulling the veins out?
Yeah, I have to make a distinction between stripping surgery, which is usually done in the hospital under anesthesia. Unfortunately, that's still done in some places and really shouldn't be done at all. But what is standard of care, but certainly not in this office still, is something called phlebectomy, ambulatory phlebectomy or microphlebectomy. It sounds good, but if you have a bulging varicosity, they're going to make a stab incision over the top of it. They're going to pull it up through a crochet hook and cut it off. I'm not saying it's a crime. I'm just saying we don't do it here and we don't think it's necessary. When you do that, first of all, it's only 20% of what's going on. Second of all, you're only taking off the tip of the iceberg, and 80% you're leaving underneath. So people feel better for a while, and they look better maybe for a while, but inevitably there's recurrences, and there's plenty of folks out there that have had these treatments done, and they don't quite get to where they need to be. medically and cosmetically. They still have symptoms, and we see a lot of those people. So 1 out of 3, 1 out of 4 of our new patients in the office have already been treated somewhere. So with foam, okay, the veins can hide, but they can't run from our ultrasound machine. So we can inject them. Again, it doesn't hurt, and we get rid of the veins you can see, and more importantly, the veins you can't see.
Dr. Pittman is an interventional radiologist, so he uses ultrasound to look for the veins. You're not just guessing.
Correct. So we are smart bombing the bad veins. Spider veins that bothers everybody are like pine needles, and the deeper veins are like a pine tree trunk and pine tree branches. So most places are only dealing with the trunks of the vein and not the branches that they can't see, because you can only operate on what you can see visually, basically. So a lot of these diseased branches are left under the skin, and with foam, they can hide, but they can't run from my ultrasound machine.
Yeah, that's a real distinction between what you do and what other doctors do, because I have a lot of girlfriends that have had their veins done, but they come back.
Yep.
They come back rather quickly, and they come back to the point where they're just exacerbated. They feel like why bother?
And we've seen probably 2 patients today with the black ankles and the feet, and they've been treated in the past, and they still have symptoms, and they're still disturbed. They still haven't worn shorts in years and years, and we can help those people because of the foam technology. I didn't invent foam. It's been around for decades. It's used all over the world in the better places. Like France is way ahead of us on phlebology and venous stuff, and that's generally all they use in France. And we also use foam when we do spider vein treatment. Don't let anyone use saline on you. That is outdated, shouldn't be used. Problems with it, there are FDA-approved agents to use, but we take these FDA-approved agents and we mix them with air, and it makes a foam. And very simply, it's more effective, and we can do more veins, less needle sticks, more effectively with foam sclerotherapy of cosmetic spider veins. So I want to make a distinction. We use foam for medical veins that are big and under the skin or bulging the skin, but we also use foam for cosmetic.
Okay, let me ask you, cosmetic versus medical. I am sure a lot of women are wondering if they have leg veins that need to be treated. Is it a medical condition that is covered by insurance, or is it a cosmetic procedure that is not?
Well, yes. The short answer is yes. When people come in to see us, we have to decide, are they medical, cosmetic, or both, and most people are both. Any cosmetic issue below the knees, in my opinion, it has a medical cause or etiology. Because vein disease is very simple. It's plumbing. It's leak in the attic, flood in the basement. What we see and feel is from about here down, but the problems start from the groin down. And we're talking about veins under the skin, not in the muscle. The veins in your muscle are important, and they take all the blood out of the leg.
So people don't need to be scared that you're going to be taking out any veins that they need.
No. Okay. So yeah, the veins in the muscle, important, we don't mess with those. Then there's a whole set of veins under the skin, between the skin and the muscle, living in the fat there. They're not important, but they're the ones that cause most people most problems. And when those valves fail from various reasons, the blood trickles the wrong way. So we talk about leak in the attic, flood in the basement, or a waterfall. At the bottom of a waterfall is a beautiful pool, and in humans, it's a bunch of crappy stuff. So, swelling, skin changes, all the things we know about. So the strategy is get an ultrasound and block off or ablate and get rid of all those leaking veins. And
it makes a difference in how you feel, too.
Big time. So to more directly answer your questions, most people come in and they have symptoms as well as problem or cosmetically disturbing veins, and they don't realize that their symptoms are coming from the medically related vein issues. So every payer insurance company in the country will pay for an initial consultation and an ultrasound if you have any symptom in the leg. And sometimes it's not even symptoms. It may just be swelling.
That's another thing. I think a lot of women aren't aware, and men too, that swelling in the legs can be treated with vein care.
We are, absolutely. The leading cause of swelling, ankle swelling in the country is undiagnosed, untreated vein disease. You do not have to have a bulging varicosity to have a serious vein problem. Probably half of people with lifestyle-limiting problems and symptoms from vein disease never develop a bulging varicosity, and we don't have time to get into all of that. But that's why it's a big education and outreach issue. The leading cause of ankle swelling, you heard it here, is undiagnosed and treated vein disease. And if you have any symptoms in the legs or a sign like swelling, the ultrasound and a consultation are always covered. Them all, but restless legs and night cramps, very highly associated with medical vein disease. If you have that, over 90 to 95% of people in this office, it either goes away or gets significantly better. The reason those two entities are important is, first of all, it's unrecognized association with vein disease, but it also helps people sleep. And when they sleep better, because they feel better, they have more energy and well-being, and they lose weight. And we've got an article on the wall over there. They'll drop 10, 20, 30, 40 pounds in 6 months because they have more energy and well-being, and they can exercise and move around. It's crazy stuff. But
I think a loss of mobility is a real problem in people that have vein disease.
Especially as we age. We have a 100-year-old lady we saw in here. You're never too old to have vein care. Even if you're not moving, you may need vein care if you're in a wheelchair. So the leading cause of ulcers, ankle ulcers or foot ulcers in the country is undiagnosed, untreated vein disease. And so that's another biggie that we don't have time to get into. But in any case, there's a lot of people that suffer. You're never too old to improve your mobility, get rid of your swelling and skin changes and all that. So,
the improvement is incredible. I mean, I like to try these procedures myself so I can talk about them. And I did the hand veins and I did the leg veins, and it just got to the point where I don't even think about them anymore. It used to be, I had to be careful what I was wearing because I was showing the veins in my hands. Being on camera, I would put my hands. Now I'm just like back to normal.
So this is our Van Gogh machine, kitschy name after Vincent Van Gogh.
Van Gogh.
And what this is excellent for is spider veins above the waist. The standard of care below the waist is injection sclerotherapy. And you know me, I'm a recovering detail guy. I'm going to say more than people want to know. But this is not a great machine for below the waist because veins in the legs are under pressure. And the gold standard, ladies and gentlemen, is injection sclerotherapy with either liquid or foam. And we spent a lot of time talking about foam. Above the waist, where veins aren't under pressure, this is a great machine. And it doesn't have hyper or hypopigmentation issues like a laser might, a surface laser. There are surface lasers, obviously, that can deal with facial spider veins and even cherry angiomas that we're going to talk about. But it tends to cost a lot, multiple visits. This is instantaneous, and it doesn't have any hyper or hypopigmentation issues. And it is great for spider veins in the face and cherry angiomas. There's little red dots that become spots.
I know what they are, yeah.
That heap over. And a whole lot of people have cherry angiomas, and they can grow anywhere. Cleavage, butt, scalp, hairline, eyebrow, face, it doesn't matter. And they're very disfiguring, and dermatologists just don't like dealing with them. They're overgrown capillaries. And so this machine's excellent for that. Spider veins around the nose and coming down under the nose here. A lot of people with spider veins.
A lot of women have those and try to cover them up with makeup.
Guys and gals, and this is an excellent machine in general for those. They're immediate. They come in, it's like just wiping them off. It's an immediate treatment, and patients go out of here looking great. So Becky, I don't think you've ever seen a Van Gogh.
No, but I do know a lot of people that have these little veins around the corners of the nose like that.
Well, just got a tiny one right here. And it's gone.
Seriously?
Wow. I wouldn't have believed that if I didn't see it.
Average.
No, you have a great staff. All your patients were telling me that.
Well, we're the best places to work. I like working here. I don't know how long they're going to keep me around, but we're a Tampa Bay Business Journal best places to work. This is Stashis.
Hi there.
She is double bachelored, ladies and gentlemen. This is just any old front office gal. She's got a lot going on. She's going to medical school.
Wow. You're Victoria.
She's our clinical manager, and she's going to be a PA when she grows up.
Oh, fantastic.
She does some production here for us. She's good in front of and behind the camera. She's
I'm
very,
trying to be like
very,
Becky.
very
Hi.
Libby's an FSU graduate, and she's going to be a PA when she grows up. And this is Miss Nafia, and she's a current USF Bull, and she's going to be a medical student and doctor when she grows up. And she'll be
Wow, all these wonderful young people.
Who we got? Oh, I know.
Who's in there? What? Somebody hiding?
This is cute, Mai, and she hates the phone and the camera, but she's just wonderful in every way, and we love her to death.
Bring her out.
We love her to death. She hates attention, and she's the hardest working person here, and she'll work really double hard if she doesn't have to call anyone on the phone or be on camera. So, thank you, Mai.
Thank you. Nice meeting you.
Nice meeting you.
Okay. And I can't help but notice the lamp from, what was the movie?
A Christmas Story.
Christmas Story, yes.
It's fragile, remember?
Yes, I do.
So we had to have this. So.
All right, get over here. Okay, who is this?
Director of Operations, and he hadn't been with us too long, but he's fitting in well, and spent a lot of time with Ideal Image hair removal,
okay.
and then Laser Spine, both very large national companies, which Vein 911 will be when we grow up.
Very soon.
We are growing. There's no doubt about that. And Matt's gonna.
So how do you like working here, Matt?
Oh, it's great. It's like a big family, but all females, and then I get to go.
The one guy? You're the one guy?
So I get to take out the trash and all the other stuff, reach high things, and
This is the dynamic duo. This is Angela, our world-class physician assistant, and this is Jill, our world-class ultrasound technologist.
Okay, and
this is Maddie. She's
Hi.
a gator. She's bachelored, and she wants to be a physician's assistant, maybe an ARP. Who knows? When she grows up.
wow, you have a lot of promising
So
talent here.
Everybody here is above average.
Yes.
This is Vein 911
I can see
University, but we can talk about that another time. But anyway, these ladies truly world-class.
Wow.
Take
How do you
it
guys
away.
like working here?
We love working here. We have fun every day at work.
Yeah.
It's so fun, as you saw our unicorner.
Yeah.
Yeah, and we have a great time doing procedures together. So Jill guides the procedures, and you can call us Angela. Or, that's how I introduce us, because, we're a team, and it's just really fun together. So.
And how do you like working here?
I'm very lucky to work here. It's been fun so far.
Yeah.
Mhm.
All right. Well, sounds like a great place to work. All right.
is.
All right. And everybody's like, I want to check back with all of you in about 5 years and see what everybody's doing.
Right.
Lots of stuff going on.
Noted.
Well, thank you very much.
Thank you.
Anyways.
Okay. Well, thank you very much. Nice to come and visit you again. Learned a
Too
lot.
long, Becky. We've been trying to get you back up here. Tampa, we're a backwater for those Boca people. But
Oh, Tampa's a great town.
But one of these days we'll have a satellite down there.
I've been expecting that.
Down there
Yeah.
and do some hand stuff. So anyway, we really appreciate it.
Okay, so that was interesting. Vein 911 with Dr. Christopher Pittman in Tampa, Florida, and his wonderful staff. I'm Becky Mboka, signing off.